Hi, my name is Beverly Blake, and I'm going to be talking to you today about OraQuick. So, the person most commonly affects homosexual and bisexual men. The source of this graphic is from the CDC. You can see where the highest rate of people with HIV and AIDS are black men who have sex with other men, followed by white men who have sex with other men, and then Hispanic and Latino men who have sex with other men. Then you can see where underneath that there are some other categories of heterosexual contact um, that follow. So most of the people that this OraQuick rapid test will affect are going to be people who have HIV or AIDS or possibly have HIV and AIDS, which are most commonly homosexual and bisexual men. The place for this study that we are going to be looking at was conducted by the CDC in 2015, and it was being studied in the United States because there were subpopulations in the U.S. were being studied. For our purposes, we are going to be looking at Jackson, Mississippi as the location. Time. HIV and AIDS can occur at any time. There has been an epidemic of HIV and AIDS around the globe for many years now. And we are going to be looking at some statistical data from the HIV surveillance report for 2015, which is published by the CDC, or the Center for Disease and Control. Our national prevalence rate is 299.5 per 100,000 people. So from 2010 to 2014, the number and rate of persons in the U.S. living with diagnosed HIV infection increased. At the end of 2014, 955,081 people in the United States were living with HIV infection that had been diagnosed. So that is how the prevalence rate was 299.5 per 100,000. Now we're looking at the local prevalence rates from Jackson, Mississippi. It is 273.2 per 100,000. Also, according to the HIV surveillance report, for Jackson, Mississippi, the people living with HIV was 1,580. So, for natural history. So, natural history is basically the progression of the disease over time in the absence of treatment. HIV can be transmitted during each stage of the virus. Stage 1 is acute HIV infection. This is usually about 2 to 4 weeks, and it can be a flu-like illness, so many people don't even realize that it's HIV. They may think that they are just sick with like the flu or some similar illness, even though there is a large amount of virus in the blood at that time. The second stage is clinical latency. So this is when it's active, but it's reproducing at very low levels. The person may not show any symptoms of HIV or AIDS, even though, there is no set time frame for each of the stages, meaning that people can move through these stages at their own rate, and it could be different from person to person. For someone who is not being treated and they're not taking medicine, they could be in this stage for about 10 years or longer, even though some people may progress through it faster. Then someone who is being medicated and they are being treated, it could last several decades in this stage. While in this stage, they can still transmit the virus to other people, but those on medication or those being treated are less likely to transmit it than those who are not on the medication. So, and also like toward the end of stage 2, the virus levels begin to increase. And then the third stage is when it becomes AIDS. This is the acquired immunodeficiency syndrome. This is the most severe phase, and their immune system is badly damaged. And when someone's immune system is very weak and damaged, it also leads to the person increasing their chances for them to get other sicknesses, which are called opportunistic illnesses, and this can be very severe. Without treatment, People normally survive about 3 years after they have reached stage 3 of HIV. So, the purposes of screening and level of protection. There is no known cure for HIV and AIDS, so prevention is key. There are some different strategies such as screening, safe sex education, identifying and treating STIs, and just a little bit more background knowledge. We know that HIV is transmitted by direct contact with infected blood from someone who already has HIV, sexual contact, direct contact with semen or vaginal and cervical secretions from someone who is infected with HIV, and then mothers who are infected can also pass that to infants during pregnancy, delivery, and breastfeeding. So the primary prevention level would be education. So like I said, education could be one of those prevention strategies. Primary prevention is trying to prevent it before it even happens, whereas secondary prevention is regular exams and screening would fall under this, and this is trying to reduce the impact of the disease after it has already occurred. This is done by detecting and treating disease as soon as possible to halt or slow its progress, encouraging personal strategies to prevent the reoccurrence, or we're just trying to slow it down at this point. So our OraQuick test, the HIV rapid test that we are talking about for this specific study, would fall under secondary prevention because it falls under that regular exams and screening. So the purpose of the HIV rapid test, OraQuick. So this is an oral test where the individual swipes the gums and there's no blood test involved. So this allows individuals to test themselves in the privacy of their own home. It's a very easy test to administer. It's simple, and this early detection can help lead to early treatment. The test kit that comes with this comes with step-by-step instructions, so it's very easy to follow. There's an oral swab test stick and tube with solution. There's also information packets on HIV and different testing, and also information about this specific test. They also have a 24-hour support center that individuals can call for support or to ask questions. Their website is very helpful. There are even videos on their website where the individual can go look and actually see the step-by-step test being administered. So with screening appropriateness, HIV is appropriate for screening because there is no known cure. Prevention is key, like we said before, and early detection is important. If we want to lower the number of people living with HIV and AIDS, we have to be able to detect it early and keep educating people on the transmission so we can lower the amount of people that have it. Some different characteristics of the OraQuick test. Sensitivity is 91.67% and specificity 99.98%. Now, sensitivity is the probability that a test result will be positive when the disease is present. So this is the true positive rate. Whereas specificity is the probability that a test result will be negative when it is not present. So your true negative rate. With this, there was a clinical trial performed where they had 4,999 people who were unaware of their HIV status. They did not know whether they would be positive or negative. They were given this OraQuick test to take home and use on their own. Then their results were compared with laboratory results that were performed by a trained professional, so like a blood test from a doctor. The lab results showed that 96 people were HIV positive and 4,903 people were HIV negative. So once their results were compared, 4,902 out of the 4,903 correctly reported a negative test result. So only one of the 4,903 reported a false positive, meaning that they reported a positive test even though they were not actually infected. And then 88 of the 96 that were HIV positive reported a correct test result. So only 8 of those 96 were infected and reported a negative result. So this is also called a false positive. So some other strengths and weaknesses of OraQuick. Some strengths: it's an easy, accurate test. The people who put out this product have given plenty of instructions and plenty of support for the individuals to be able to administer this test at home. Another strength is that it can be done in the privacy of their own home. They could do it wherever they need to, and they get results in in 20 minutes. So it's a easy, quick thing. They don't have to wait days for results or anything like that. There's also no doctor's visits necessary. It's very affordable from drugstores. It costs like $40 from Walmart. You can get it like CVS, Rite Aid, other chain drugstores. You can just walk in and get it. Some weaknesses, however: there's no blood test, so maybe some people might not think that the results are going to be quite as accurate, even though from the clinical trial we see that it is pretty accurate. Access: some people may not be able to afford that $40 from the drugstore. Some people who might fall in that category of being at risk for HIV may not be able to afford that. So that's why this study here in Jackson, Mississippi is so important, to see about the feasibility, to see if it were more available, would it be helpful? And then depending on the timing of the test, the results could be changed a little bit. That is just one weakness, that we could see the blood test would be better off than the OraQuick. Some ethical issues that may arise: like with any study, informed consent. So just making sure that it is abundantly clear what the study is about, how the study is going to be conducted. And here in Jackson, we are trying to see if the feasibility and if it is available or more easily available for people, would they take part in that? Would they find it helpful for them, or would they take the test at all? And then confidentiality is another big thing with all studies and all research. Just making sure that their individual's personal information is kept confidential, especially with medical test results and things like that. All of those things should be kept confidential between the people doing this research and the patient themselves. And then here are my slide of references. Thank you. Have a good day.